second type of quantitative assessment when it comes to Doppler waveforms is the acceleration time. The acceleration time is the time from the beginning of the systole to the peak, which we can also say is the upstroke. Now in this case, we can apply something we learned in hemodynamics to this type of testing. Remember when we mentioned when you have a slower upstroke, or in other words, when you have that delay in getting to the top, that would be an indication of a tardus parvis waveform, where we have our energy losses. We can also say that means the acceleration time is increased. Because when we compare it to a normal waveform here, the upstroke is quick, and so the acceleration time is short. But when our acceleration time is longer, it's delayed, it takes longer to get to the peak, that would be indication that we are already in the zone of energy losses, which means the disease is proximal to us. We can also say that the disease would be inflow disease because it means where the flow is coming from. So an acceleration time greater than 133 milliseconds in the lower extremities would be an indication of having inflow or proximal disease. When the acceleration time is not affected at all, even if the waveform appears abnormal, then that means there is no proximal disease. So normal upstroke, no disease before us. Abnormal upstroke, there was disease before us.